welcome to our Physicians Career Panel. On behalf of the Saskatoon Industry-Education Council, we'd like to welcome you to our event today. We acknowledge we're on Treaty 6 territory and homeland of the Métis. We want to welcome students, parents, and teachers from across Saskatchewan joining us. For the past 2 decades, the Saskatoon Industry-Education Council has bridged the gap between Saskatchewan school systems and employers, providing experiential learning and career development opportunities for Saskatoon and area youth. As a registered nonprofit, the SIEC works in partnership with 3 school divisions and the Saskatoon Tribal Council, community-based organizations, government agencies, and employers to help nurture the workforce of tomorrow. Last year, the Saskatoon Industry-Education Council worked with over 29,000 youth, 1,300 business partners, and over 600 educators and career practitioners. The SIEC hosts over 40 events and programs each year, including our Spotlight on Careers, which are a series of targeted events providing students with experiential learning opportunities. Our Skills Boot Camps are programs that provide students with hands-on experience in various careers. Connected, a female mentorship program connecting females in grades 10 through 12 with mentors from a wide variety of sectors in Saskatoon. And the Summer Youth Internship Program, which is a 6-week paid internship where students gain work experience in construction, manufacturing, automotive, culinary, and the IT industries. Students can earn competitive wages and high school credits. For more information, visit our website, saskatooniec.ca, and follow us on our socials to stay up to date with our new program offerings. At the SIEC, we feel it's just as important for you to find out what you do not want to do as it is to discover what you do want to do as a career. So if you're not sure what you want to do after high school, we highly recommend you attend a few of our events to discover what is involved in various career options. I want to thank the panel of volunteers who are sharing their career journeys with us today. Thank you to our post-secondary representative who will share important details about applying for their programs. And we want to encourage all participants to use the Q&A function to enter any questions you may have, as there will be time to ask at the end. We'll now begin with the post-secondary representatives joining us. Cheryl Beukert was born in Saskatoon and raised on a farm by Pike Lake. Cheryl completed an administrative program at Saskatoon Business College in 1982. Right after graduation, Cheryl began working at the U of S and found it such an interesting and diverse place to work. She started in the Department of Biochemistry and then in 1993 decided to be a stay-at-home mom with her 3 children and to help work on her family's cattle farm. In 2006, she returned to the U of S, where she still works today in the College of Medicine admissions office. Cheryl has 3 grown and married children and 2 wonderful grandsons, Henrik and Anders. She loves spending her time with her children and their families, as well as continuing to run the small cattle farm. So Cheryl's going to share a short video with us from the College of Medicine, and then she's going to share some important information about how you can apply for their programs and information you need to know before applying for the program.
Medical doctors are incredibly important to the people of our province and world. A career in medicine is an opportunity to do exciting hands-on work that is highly valued by society. There's no better place to study medicine than the USask College of Medicine. Our college offers the best training possible for doctors, especially those who go on to practice here in Saskatchewan. You'll gain experience in a range of urban, rural, remote, and Indigenous communities. Our program is especially known for the many and early opportunities for hands-on clinical learning. You will learn in new, state-of-the-art clinical and research facilities. Ours is a student-friendly environment with many opportunities for one-to-one mentorship from physicians who know your name. Our medical doctor program is also exceptional in Canada because of the diverse avenues for entry, a 4-year undergraduate degree that can be focused in science, arts, humanities, or other disciplines. A top choice of our medical students for their pre-degree is our Biomedical Sciences. The USask Colleges of Medicine and Arts and Science have partnered on a modern, revamped degree offering in the Biomedical Sciences. You can apply to this brand new direct entry program now. There is no better place than USask for biomedical and health science studies. It's the only university in Canada with all the health sciences located on one campus. And it's home to Vito Intervac, world leader in vaccines and infectious diseases, as well as the Canadian Light Source Synchrotron. The new USask Biomedical Sciences program provides a solid academic foundation grounded in innovative interdisciplinary research and experiential learning opportunities. All of the 4 majors offered prepare students for success in a wide range of careers in the health sciences, including medicine, veterinary medicine, kinesiology, pharmacy, physical therapy, and of course in research. These degrees also prepare you to work as biomedical science experts in other fields, business, communications, teaching, and regulatory industries, to name a few. The USask Medical Doctor and Biomedical Science programs are second to none. Together, they provide a solid future in medicine. If your ultimate path is to medicine, choose from diverse 4-year USask degree options, including Biomedical Sciences. If you're uncertain but interested in a future in the health sciences, a USask Biomedical Science degree is an ideal path.
Good morning, everyone, and welcome to my presentation this morning. I'm Cheryl Beukert, the admissions coordinator from the College of Medicine. And as you've heard in our video, we do have our MD program, and we also have our Biomedical Sciences program. We are Saskatchewan's medical school. There is only one medical school in Saskatchewan, and we have teaching sites in the far north, in Prince Albert, in Saskatoon, Regina, and in the south part of the province, in Estevan. Each year, our college accepts 100 new students into the MD program. After year 1 of those students all studying in Saskatoon together, then we split the class, and 60 of the students train in Saskatoon still, and 40 of the students start their training in Regina. And they would stay there for years 2, 3, and 4. There's also other options where in year 3, they can choose to do years 3 and 4 in Prince Albert, or in year 3, they can take the Saskatchewan Longitudinal Integrated Clerkship Program and practice their studies in either Meadow Lake, Melfort, or Estevan. So what do you need to do to apply to medicine? Well, first you need to complete a 4-year degree. We have no degree preference, so you could complete a 4-year degree in any subject area. We recommend that you do select a subject area that interests you, so you will do well in your studies. And also, if you don't get into medicine the first time you apply, or if your life plans change, you'll have a degree that you could have a fulfilling career at. You will also need to have at least a 75 average over all courses taken in that degree. And you will also need to complete the Mcat, or the Medical College Admissions Test. So those are the academic requirements that you would need to meet in order to apply. For the personal factor assessment, new this year, we have students writing the Casper Test. And our program for the College of Medicine is just one of many programs at the University of Saskatchewan that requires Casper. Our postgraduate program is also using it, and also our the physical therapy or rehabilitational sciences program at the university. You will also need to complete the multiple mean interview process and have 3 references completed from someone who has supervised you, either in a research, employment, or volunteer setting. We don't have reference letters that you need to submit right now, but these people would need to take a telephone call from our office. And we have a set of questions that we ask, a standardized set of questions that we would ask each of the references. We also check for academic and non-academic misconduct. So if there is any record of that at any institution, post-secondary institution that you've attended, we would be checking for that as well. So in the video, we talked about the Biomedical Sciences program, and this coming fall will be the new intake of the new Biomedical Sciences program at the University of Saskatchewan. And we have no degree preference for that 4-year degree, but this is one degree that you might consider looking at. Certainly, if you have any questions that you would like to ask regarding that, contact our Biomedical Sciences division, and an advisor would be happy to speak with you. So the streams for applying to our college, we have 4 streams currently right now. We have the Saskatchewan resident stream that has the most seats available in it. We have the Indigenous admissions pathway, where there are 10 seats set aside for students who self-identify as First Nations, Métis, or Inuit. We have our non-Saskatchewan resident seats, so there's 5 of those, and that would be for applicants who are not residents of the province or who do not meet our residency definition. And then we also have our 4th stream, which is the Diversity and Social Accountability Admissions Program, and we have 6 seats set aside there. So just to talk about those some of those individual streams, we have the admissions, Indigenous admissions pathway. And currently, right now, we have 36 Indigenous students enrolled in the college over the 4 years of medicine. We offer a mentorship program, Mcat preparation support, MMI or the interview preparation, and there's also our pathway support for Indigenous students to pursue medicine. And these are funds, monetary funds that students can apply for prior to entering into medicine. Val Arnaud-Pelche is our admissions coordinator, and certainly if you would like to set up a meeting to speak with Val about our Indigenous admissions program, please contact our office and we would be happy to do that. And our Diversity and Social Accountability Admissions Program, or DSAP, we call it for short. And again, there are 6 seats, and these are for students, Saskatchewan resident students that come from a lower socioeconomic background. The main entrance criteria is currently if the combined family income average for 5 years is less than $80,000. And if a student meets that requirement, then there are additional questions that would augment your admission score to be considered for those 6 seats. And they're based on a multiple of different predetermined socioeconomic factors that create barriers for students to apply to medical school. So if you have questions, I look forward to getting your questions today, but if you don't get time to answer them, or if you think of something after we've signed off today, then please check out our website. Please email our office at med.admissions@usas.ca. And the other thing I'd like to mention is that in the fall of 2019, there was an external review of our admissions practices and policies. And as a result of that, there was then an admissions retreat held last February with many of our stakeholders present. And so currently what we are working on right now is there is a renewal process of our entire admissions process, policies and requirements. And so we ask that because you are still in high school and you have the 4-year degree to complete ahead of you as well, that you stay tuned for any future changes with our website, with our office, just so that you keep up to date on what the changes are and the new requirements and policies and processes. Thank you very much, and I look forward to taking your questions. Thank you.
All right. Thank you very much, Cheryl, for sharing that with us today. We currently don't have any questions, which really surprises me. However, I do have a question for you. So you talked about the aspects of the application process. How does volunteer work fall into the criteria?
Currently, right now, under our current processes, we don't take an accounting of the actual volunteer experiences, hours, it's kind of a take a tally that way. But we do encourage students to volunteer so that they can learn about themselves, possibly if they can have a volunteering opportunity, maybe in a hospital or care home. Right now, that's a little bit difficult, but once I think things get sorted out with pandemic, then those volunteering opportunities will be there again. But it just helps students to learn about themselves. It helps develop their character. They learn, to maybe be in a situation that's outside of their comfort zone, working with a team, that sort of thing. And we feel that those experiences will come through in their interview process. And certainly if they're looking for a reference, then someone from a volunteering, a supervisor from a volunteering activity will be a great choice there. Going forward, with the processes we're looking at and possibly changing, that might change how volunteering is looked at in future.
Awesome. Okay, now we've got the questions coming in for you. So, what is the Casper test and how do we prepare for it?
So the Casper test is an online situational judgment test, and you really can't prepare for it other than going on and onto their site. So it's like Casper, just kind of like Casper the Ghost spelling, but it's capital CASP, small e, small r. There are some practice exams in there, or practice tests. And like I said, you really cannot study for it. It's just sort of who you are, your character, your life experiences, and how you react to, you're given, I believe it's 12 different vignettes, scenario type things, short videos, and it's, you're presented with a sort of a real life kind of dilemma or situation, and it's how you respond to that. And so I invite the students to go on and look that up. It's quite interesting. And a lot of our health sciences programs here at the U of S are now moving to that Casper test. So
awesome. Okay, so and the next question is, what is the difference between MD programs and biomedical sciences?
So the biomedical sciences they're both undergrad degrees. Let me start there. The biomedical sciences, you would be studying the areas of microbiology, anatomy, cell biology, biochemistry, physiology, pharmacology, those types of areas. And because you do need to complete a 4-year degree prior to entering into medicine, that program would be one option for you to go into. And basically you start sort of in a core program with them and then branch off into your kind of an area that you would like to go to, whether it be biochemistry or something else other than that. The MD or the medical doctor program is that. It is the degree where you would come away with your medical doctor degree. Now, once you have that medical doctor degree, you cannot go out and start practicing medicine. You do need to complete postgraduate or residency training, we call it, and that training has to come following your MD degree, and it can be anywhere from maybe 2 years for family medicine, be a general practitioner, to anywhere 5-6 years for some of the more specialized areas, say surgery, anesthesia, pathology, that sort of thing.
Okay. We did have a question in the chat, or sorry, in the Q&A, but I'm not 100% sure what they were trying to add. So it says, to top in Mcat, which courses do you prefer to be taken as an undergraduate? So I think they're asking if there's is there an undergraduate course that would be best to prepare you for the Mcat?
Well, I can tell you that we don't have any high school prerequisite courses that are required to apply to medicine, and we don't currently have any university level courses that are required to study, to enter into our medical program. You do need to have that 4-year degree completed. Now, to prepare for the MCAT, we recommend that students take introductory courses in the areas of physics, biochemistry, biology, psychology, sociology, statistics, those sorts of courses. So it's kind of depending on what undergrad degree they pick, will sort of depend if some of their requirements for that degree help them to cover off on, some of the topics that they need to cover to prepare and be successful at the MCAT. It may be that they take a degree where some of those sciences are not involved, and then they will have to look at ways of self-studying or preparing for it. And there are online classes, there's prep materials, or they may be able to fit some additional electives into their degree program just to prepare themselves.
Awesome. So we do have 2 more questions that we'll quickly address before we move on to our panelists. So the first question was, will a nursing degree be a good option for entry?
A nursing degree is one option for sure. We do have students that enter our program that have completed a nursing degree. Sometimes students, they complete the nursing degree and then actually go off and, they work for a year or 2 as a nurse, while they're applying. If they, maybe they choose to go off and work first as a nurse for a while, or maybe they aren't successfully admitted into medicine the first time they apply. So a nursing degree, yes, that's one option. But again, we don't have a preference. So that is one area that we do see students come from. And I'm sure, there are some, there's some transferable skills, certainly between nursing and medicine, but definitely, it's not a requirement that, that you would have. You still will need to study some other subject areas. I know some of our nursing students find that some of the sciences, they have to do a bit more work on that too, for the MCAT.
Okay, and the last question we'll take before we move on is, how is the location of residency determined? And do you have to complete residency in the same city that you graduated, or do you have some say in where you end up?
Okay, I'll answer that in sort of a general sense, and certainly later on in the panel, perhaps Nicole, who's a current resident, could definitely speak to that as well. Residency, so for that you would apply for residency, or you go into the CARMS match for the Canadian residency. In your 4th year medicine, when you're entering your 4th year of your degree, you apply, and you can apply. You apply based on your interests and what specialty area that you would like to enter into. But again, not everyone will be chosen for the area specialty that they've applied for, and you don't do your residency necessarily in the city that you studied in, or even in the province. So depending, you apply for your specialty, and then depending on where you get selected, and which specialty, then you go to that city and study. But I invite Nicole to talk a bit more about that.
Okay, awesome. Well, thank you, Cheryl, for joining us today. And maybe if I could get you to put the admissions email address in the chat, that could help some students if they have some further questions and they can direct them to you.
Definitely, I'll do that. Well, thank you everyone for your time today.
Thank you for being here.
Bye.
All right, so we are going to continue on with the next portion of our panel event, where we're going to hear from 3 doctors. Our first doctor we are going to hear from is Dr. Natalie Garrett. She's a child psychiatrist and assistant professor with the Saskatoon Department of Child Psychiatry. She completed her undergraduate degrees and her degree in medicine at the University of Saskatchewan. She then completed her general psychiatry and child and adolescent psychiatry fellowship in Saskatoon. Dr. Garrett started practicing as a child psychiatrist in Saskatoon this past July. She works in an outpatient clinic in hospital at the Dubé Center for Child and Adolescent Mental Health and in consultation liaison psychiatry at the Jim Pattison's Children's Hospital. Dr. Garrett sees children and youth with various diagnoses, but has special interest in seeing those with co-occurring medical diagnosis, autism, and developmental delays. Dr. Garrett is originally from Kindersley, Saskatchewan, and she lives with her husband and dog in Saskatoon and is expecting her first baby at the end of December. So please welcome Dr. Natalie Garrett.
Hi, everyone. Thanks, Michelle. Yeah, I can just tell you kind of a little bit about sort of what my, day-to-day work looks like. As Michelle said there in my bio, I've kind of done all of my training in Saskatoon. I did my residency in Saskatoon, was lucky to, be able to do that. I'll say kind of starting off because it gets mixed up quite a bit. So I am a psychiatrist. I'm not a psychologist. We're kind of similar and it sounds very similar. Both, psychiatrists and psychologists often work in areas of mental health. But a psychiatrist is someone who goes through the medical doctor program. So I've gone through, any kind of the same, medical school that say a surgeon would have went through or a family physician would have went through. But I just ended up taking kind of a mental health route in my residency. My day to day, Michelle said, I work mainly in an outpatient clinic, which a lot of right now has been virtual, but obviously that's just kind of new for this year. And I see anyone under the age of 18. So the youngest kids that I've seen, the youngest kids that I've kind of followed have been around age 4, and then all the way up to 18 and sometimes a little bit older. But I see people that have difficulties with their mental health. So that could be anything from, anxiety or depression to psychosis or schizophrenia. And then I do, especially in younger kids, see a lot of kids that have some developmental delays or maybe learning disabilities, autism, things like that. And then I also work in the hospital at the Dubé Center for Mental Health and at the Jim Pattison's Hospital. And again, that can be a wide range of diagnoses that people are struggling with. See a lot of patients with eating disorders, lots of different things. And then really I'm kind of focusing on both, a kind of counseling side of medicine, but then also being able to use medications and other ways to help to treat mental illness. It's a very, very fulfilling career. It's a little bit different than, it's kind of a different path to take in medicine. A lot of people, when they get into medicine, they kind of look at, okay, am I going to go in a medicine direction or maybe in a surgery direction? And then psychiatry is a little bit, it's in the medicine direction, but it's kind of a little bit different than a lot of other physicians because, I'm not someone who is often, I'm not doing physical exams necessarily. I do sometimes, but not that often. So it's just a little bit different. And it's a lot of talking that I do in my day-to-day job. But yeah, it's very fulfilling. It's really nice to see, especially in child psychiatry, to be able to kind of intervene and make some changes early on in people's lives and to see, how they do moving forward. Every day is very different. So we get to know everyone's story really, really well. I get to know my patients really well, which is a very, it's very, very interesting and quite a privilege. And it's just, I just found as I went through medical school, I got to do lots of really, really cool, interesting things, got to be in on, surgeries and deliveries and all this really awesome stuff. But for me, I just found, the brain and kind of the psychology of people the most interesting. And there's never a dull day. And right now, mental health has really been kind of at a peak. So things have been very, very busy. Definitely will always have a job kind of anywhere, in the country as a psychiatrist, for sure, as a child psychiatrist. And that's kind of my day to day. I usually work from 9 till 4:30, if I'm doing clinic, and seeing people every half hour to an hour. And then same thing if I'm in the hospital. That's kind of my, Monday to Friday, 9 to 4:30. And then I also do some on-call and some things in the emergency room in the hospital where I'd be working maybe overnight, but generally it's kind of a regular schedule. It's kind of my job.
Well, thank you so much for sharing with us today, Dr. Garrett. What would you say one of the biggest challenges in your role is?
For sure it can be like emotionally taxing, because sometimes I'm seeing people, especially with kids, seeing young kids that have maybe been through some very, very difficult things in their lives, maybe kids that have been through, different abusive situations or, different traumas. So that can definitely be very, very difficult. And so just kind of go a lot with trying to do a lot of self-care and, that sort of thing. So that can definitely be difficult. And then it's always tough. I think this goes for really any type of specialty, but we never have enough, space or enough, funding and that sort of thing for our patients. And so we're always looking for that, or enough outpatient, enough resources out in the community. So that can be really tough too.
All right. Well, thank you for joining us. Dr. Garrett is going to stick around, and we will have a Q&A with the three doctors in a few moments. So if you do have questions, you can put them in the Q&A and she will answer them shortly. So thank you, and we'll see you again. Next, we are going to hear from Dr. David Campbell. He is a professor at the University of Saskatchewan and the immediate past department head of the Department of Anesthesiology, Perioperative Medicine, and Pain Management for both the University of Saskatchewan and the Saskatchewan Health Authority, a position he's held for over 15 years, during which he served as the president of the Association of the Canadian University Departments of Anesthesiology. He also served as the department's director of obstetrics anesthesiology for almost 20 years, and from 1998 to 2016, and previously served as the chairman of the obstetrics anesthesia section of the Canadian Anesthesiologist Society. He is giving me a mouthful to try to get through. Very impressive, Dr. Campbell. Dr. Campbell is an avid educator of not only postgraduate residents in anesthesiology and obstetrics, but also interprofessional healthcare disciplines, including nursing, respiratory therapy, EMTs, and has traveled extensively throughout Canada and abroad as a visiting lecturer. One of his favorite teaching endeavors includes a monthly hour-long public presentation in the prenatal education curriculum offered by the Saskatoon Health Region that he taught from 1994 until February of 2015. Dr. Campbell is an author of several book chapters and numerous journal articles with primarily focus on obstetrics anesthesiology. So please welcome Dr. David Campbell.
Hi, Michelle. Thank you. Wow, that took up all of my 5 minutes, I think. I just want to share a few things with you. You're all in high school, and believe it or not, as old as this old guy is, I still remember some of those things from my high school days. I just want to share with you that I believe that education is a journey. It's not really a race. And it's also about opportunities and what you actually do with those opportunities. When I was your age, my mom, who was an elementary school teacher, went back to school, back to university. And we used to talk about all the exciting things she was seeing and learning at university. I was just really focused on taping my hockey stick, playing, refereeing hockey. I really wasn't focused on education when I was your age. And none of my friends actually went to university. So I kind of had to make a decision about what I was going to do with my life. And I chose to take the university route and go to university. When I was there, I wasn't quite sure what I was going to do. And I followed a path. I entered a program of biochemistry, quite enjoyed that. And then continued on to do postgraduate work in clinical biochemistry. And it was during that time that I actually applied to the College of Medicine at Dalhousie University. So I'm going to talk to you a little bit about my journey as well, because I'm a long way from my original home. When I got into medical school, I thought, not knowing anything, I was going to be a surgeon. So what guys did, I was surrounded by athletes. I thought maybe orthopedic surgery should do that. And a friend of mine said to me, you know what? Maybe you should go to the operating room and spend some time with somebody called an anesthesiologist. I had no idea what that was. But I decided, hey, why not? Let's spend some time with an anesthesiologist so I can see what different types of surgeons do, and then I can pick the type of surgery I wanted to do. Funny thing happened on my way to being a surgeon. I actually enjoyed the other side of what we call the curtain in the operating room, and that was being an anesthesiologist and staying on that side. I got to watch the people who were supervising me actually give medications, watch them work almost immediately, and they were actually able to reverse those medications pretty quickly, so that not only did they have people undergoing surgery go off to sleep, but they actually got them to wake up at the end, and they were very comfortable when they took them to the recovery room before they went home. So I realized partway through my medical school training that what I thought I wanted to do really wasn't what I was really starting to enjoy. And at that point, in the day when I did medical school, we did something called an internship afterwards. And we don't do those today. Cheryl mentioned doing a residency afterwards. There was actually a different path when I was a medical student. We could do something called an internship. And a very good friend of mine in medical school chose to go to a place way, way out west called Saskatoon, Saskatchewan. And she worked at a hospital called St. Paul's Hospital that offered something called an internship. I had no idea where Saskatoon was. Remember, I'm from the Maritimes, and she came back to Halifax. We met one day, and she said how great her experience was. So I actually was offered a position in Saskatoon, and I drove all the way with my little car, all the way across Canada, no idea where I was going. Spent the night in Regina because I didn't realize I could have gone right to Saskatoon, and ended up doing a year in Saskatoon called an internship. Now that was a year where you spent a lot of hours in the hospital, more than any medical student or resident would today, probably 120 to 160 hours a week we spent in that hospital. So you got to know everybody from the cleaning staff to the president of the hospital. It was like a little family. And the hospital that you see today at St. Paul's was nowhere near the size it was when I was an intern. It was basically a little rectangle. During that year, though, I met a young lady who took a fancy to me, and I took a fancy to her, and we ended up eventually getting married. She was a nurse in the hospital, and after I was completing, or partway through my completion of that year, I was offered several positions where I could do training to become an anesthesiologist, which is an additional 4 years after my internship. I actually chose to go to the University of British Columbia, so I went from one end of our country for my medical training, stopped in Western Canada in Saskatoon, and then went all the way to Vancouver to do my 4 years of anesthesia training. It was actually there that I met an individual who really inspired me and encouraged me to do a specific area of anesthesiology that involved taking care of pregnant women. And taking care of their anesthesia needs and pain relief needs when they were in labor. And then if they needed something called a cesarean delivery, that we would provide the anesthesia for that as well. That individual became a mentor of mine and provided me with another opportunity, this time an opportunity to move back to the East Coast of North America, but this time south of the border. to a place called Boston, Massachusetts, and a hospital called the Brigham and Women's Hospital, which is one of the Harvard teaching hospitals. It was there that I did something beyond my residency that I completed in Vancouver called a fellowship. And a fellowship is additional training in a very highly subspecialized area. And that hospital at the Brigham and Women's in Boston at Harvard, there was an opportunity to be part of an institution that had actually conducted 15,000 deliveries a year. So it was a huge institution with a great opportunity to do a lot of learning and to become somewhat of a specialist in that particular area. Now, remember I mentioned that I met my wife in Saskatoon, and I dragged that poor unsuspecting woman after we got married to Vancouver. And then unfortunately, I dragged her all the way back to the East Coast, closer to my own home in Nova Scotia, but south of the border, as I said. And then finally she said, you know what, enough of this traveling, I want to go home. So I said, yes, dear, we'll go home. And I was fortunate enough to be offered a position at the University of Saskatchewan's College of Medicine in the Department of Anesthesiology, and that's where my career started. Now, when my kids were little, I would tease them because I'd said, you know what, Dad started his first job 15 years after high school. Now, I know some of you are 15, 16 years old. That's been your whole life. But it's not the length of time. It's really was the journey that brought me back to what I consider my own home now. I've been here since 1994. Both of my children are here. My daughter is a nurse who works at the Royal University Hospital, and my son has graduated kinesiology and is a care provider for a young child who needs 24-hour supervision. So my children are now grown. I've had a wonderful career, and I'm still practicing as an anesthesiologist. So just wanted to share with you a bit of the journey and where, if you take advantage of some of those opportunities that you're presented with in medicine or in any other career, you might actually find yourself moving further away from home and maybe eventually even coming back home. So hopefully that helps share a little bit of what opportunities are available to, should you choose a career in medicine or any other career for that matter in your life.
Thank you so much for sharing your story with us, Dr. Campbell. Our community is very fortunate that you've decided to come back to Saskatoon and call this home. But I think that what you shared really answered some of the questions in the chat today about moving for a residency, and sometimes people see that as something scary, but we also know that a lot of youth and young adults look at that as a challenge and a way to explore the world. So thank you for sharing your story with us. Once again, if you do have questions for Dr. Campbell, you can put them in the Q&A, and he will be back in a few minutes to answer some questions with Dr. Garrett and Dr. Moroche. So thank you, Dr. Campbell. Next, we are going to hear from Dr. Melissa Moroche. She graduated medical school from Queen's University in 2000, followed by her obstetrics and gynecology residency at the U of S that she finished in 2005. She returned to Queen's to complete her care, contraception advice, research, and education fellowship in 2006. After working in private practice in Southern Alberta, Dr. Moroche joined the Department of Obstetrics, Gynecology, and Reproductive Sciences in 2010. Her work interests include contraception, teen pregnancy, and medical education. She is a proud mom of 3, including twins, who keep her very busy and entertained. So please welcome Dr. Melissa Moroche.
All right. Well, thanks again for having me. I know I've had the pleasure of doing this for a couple of years, and it's always a treat to get to come in and chat to everybody and hopefully suck a few people over to the dark side, as we like to say. I have a story similar to Dr. Campbell's, although probably not quite as long yet. He's got a few years on me yet. Have the pleasure of working with Dr. Campbell a fair bit. Yeah, I'm a Calgarian originally. That's where I am from. That's where my home is. And did my undergraduate degree there in Calgary. And same thing, I think, other than Dave, who maybe didn't quite know where he was going when he was little, I always thought right from when I was big enough to know what a doctor was, that's what I wanted to do. And I worked, my tail off all the way through high school. I tried to do the things again that I was interested in. I had a background that involved lots of sports and lots of music and lots of volunteering, and not so much doing it because, hey, that's going to help me get into medical school, but because it was interesting and it was fun and it was something to do. And I did my undergraduate degree in Calgary, and was able to stay at home, which was kind of nice, and did a science degree, and again, because that was what was interesting to me. Probably at the time, not a ton I could have done with it had I not gotten into medicine, but I'm sure, like all things, you would have sorted it out. So when you apply to medical school, you don't always get a big choice as far as where you end up going. You often get to go where you get in. And that's definitely what happened in my case. I applied to lots of schools and didn't get in the first year I applied, and tried it again the following year and got into Queen's, which is in Kingston, Ontario. And I have to say at the time, kind of like Dr. Campbell had to look on a map to find Saskatoon, I had to look on a map to find Kingston. I knew where Ontario was, but it's, this smaller city between Toronto and Ottawa. And went out there and had a thoroughly fantastic time. And then applied into residency. And again, often when you're looking at residency programs, the thing you want to do, when I first was looking at doing that, I was actually wanting to be a family doctor. I had no plans on being a surgeon. I had no plans on doing a specialty. My biggest plan was hopefully to come back west, because I enjoyed Ontario, but all my family and everything was back west. And then just before Christmas of my third year, I got in, actually my fourth year, and was doing my rotation, because you get to spend time doing different things around the hospital, as Dr. Garrett had said, and I got into the labor and delivery ward and on obstetrics and gynecology, and I always kind of thought that delivering babies would be pretty cool, and it was pretty cool, but the part I didn't know was that I actually really liked being a surgeon, and got into the operating room and realized what an environment that is, and fell in love with it, and so at the last minute rerouted my application and got into O&G, and because of that, sometimes when you decide you're going to pick a certain thing to do, you give up a little bit on, where you're going to do it. I.e., I want to be an obstetrician gynecologist, so I may not get to pick where I want to go if that's really what I want to do. But I'll tell you, at the end of the day, that the training goes fast, and no matter where you are, it disappears quickly. And before you know it, you're done, and you're looking around going, well, now I can potentially go, where I like. So I applied out and got in Saskatoon, and I have to say most of my classmates and stuff were like, oh, gee, that's too bad. You got to go back to Saskatchewan. And I said, that's because you guys don't know how fantastic it is out there. And I'm going to go. Thank you very much. And finished here, and then went back home to work in Alberta for a few years, and then came back to Saskatoon because there was a really good opportunity that came up. And I, as of about 10 days ago, celebrated my 10-year anniversary of working here. So that time also goes very quickly, I have to say. 2 of my 3 kids have been born here, and we really like working here. It's I do a lot of work with the College of Medicine in the undergraduate teaching. So I work both with the students in the classroom in their second year and supervise them on the ward in their third year. Medicine is neat in that there is a spot, I think, for almost anybody, depending on what your interests are. There's, medicine like Dr. Garrett practices where, you do mostly talking and counseling and not a lot in the way of, say, physical exam. There's other areas where you're cutting and screwing nails and doing all that kind of stuff like orthopedic surgery. There's things like radiology where in theory you barely even see a person. You spend a lot of time looking at images. And I think there's just a spot for everybody depending on, what your personality is like and what your brain is like. There's definitely fields that have longer hours and shorter hours. I am without question in one of the longer hour fields. My typical day will run from about 7:30 in the morning till about 6 at night. Some days are longer, some days are shorter. We work overnights, obviously, and weekends because babies don't follow a clock. They don't particularly care what time of day or night it is when they show up. So we have to have coverage 24 hours a day. But again, with our unit, you get to know the people that you work with and they become your second family. And you work together as a big team. And I think Dr. Campbell is quite right in that no matter what it is that you're doing, all you don't know at the end of high school, and all you don't know at the end of your first university degree. And from high school till I started working was 13 years, and and I've been working now for almost 20, and I'm still learning, and I'm still realizing I don't know stuff. And that's the piece that has to carry you forward. It's realizing that, the learning journey is never done, and that you're always looking for the next thing, and you're always trying to find out, what's going to make you better at what you do. And so whether you end up in medicine or in one of the, biomedical sciences, or if you decide, nope, this isn't my thing and I'm going off to, write books or whatever it is that you're going to do, just remember that just because when you're done high school or done university, the learning's not done. It goes forever. But that's actually what keeps it fascinating and interesting, because, if once you got to a point it all stayed the same, that would really be very dull. And I'm getting to a point now where I'm starting to look at, what am I doing with my work and my kids, and how are we going to start to, do more things with them and that type of thing, which will be fun because that's the next new balancing act. So thanks for having me, and I look forward to answer whatever questions you guys might have.
All right, thank you, Dr. Moroche. So I'm going to invite Dr. Moroche, Dr. Garrett, and Dr. Campbell back on. And if anyone has any questions for the three of them, they would be happy to address those. I have a question here, and I'm not sure if any of you can answer it, but it's how long does a residency take in cardiology?
Probably at least, it'd be at least 6 years. If not, it'd probably be longer than that, because mine was 6 years. So I think most surgical ones are probably, once you do a fellowship, probably upwards of 8.
Well, general cardiology is 3 years of internal and then another year or so of cardiology on top of that, I think. So.
Oh, good.
Awesome, thank you.
Cardiothoracic surgery is going to keep you there for 7 or 8 years, but yeah.
All right, we have a question for Dr. Moroche. Do you find that many aspects of women's reproductive health aren't well studied, or that it's difficult to draw attention to specific issues of women's health, for example, endometriosis or adenomyosis?
I think there's a tremendous amount of research ongoing for all of those areas. Certainly for the folks that do that, we have a few of our surgeons that do more chronic pelvic pain and the more advanced surgery that comes with managing endo. There's a number of very active patient groups that are always lobbying for more time and more money and more research, and certainly our physicians are doing that as well. I think there are areas like contraception that are potentially a little more underserved than areas like endo. I do think that there's a lot of pieces of our work that, even from a basic physiology standpoint, aren't terribly well understood yet. We still don't know the exact mechanism that starts labor. We still don't know the exact mechanism of some of our high blood pressure diseases in pregnancy. So there's lots of areas where the research is ongoing, and it's not an area that's like, oh yeah, we know all this now, we're just on cruise control. I think there's tons to still learn, and new treatments to try and new medications to discover, and things like that. So there's lots left to do yet.
And so I don't see any other questions in either the chat or the Q&A, but I guess just to wrap everything up, if there's any last words of advice or any lessons that you've learned throughout your studies, throughout your career, that you'd like to share with the students who are joining us today.
One thing I just want to comment on, because there's lots of questions of, okay, what's, the best undergraduate thing to take that's going to help you in medicine, or that's going to get you into medicine. And there's definitely going to be things that maybe will make, like I didn't take any, physiology or anything in my undergraduate, and sure, those things would have been helpful in medical school. But I'd say looking forward, like far forward into what I'm doing now, I would say personally, I don't think there is a best thing to take. You take what you're interested in and what you enjoy, because that's where you're going to get the most out of it, and you're going to develop the most as a person. And if it's something you enjoy, you're probably going to get the best marks, right? If you're in something that you're saying, I need to do this for medical school, and you're just hating it, it's not going to be worth it. So take what interests you. You can take any 4-year degree. Like I knew people in medicine who had music degrees, before. So you can take anything. Take what you enjoy, and like what Dr. Campbell was saying, learning is just this big journey, right? And you're going to get positives from everything. So just do what you enjoy, and let the pieces fall, where they may.
Awesome. Thank you. Any other words of advice before I let you guys go? All right. Sorry, I lied. Dr. Natalie, there's a question for you. How is COVID being managed in terms of mental health for high school students?
That is a good question. I'd say how I kind of said before that, I think mental health right now is a little bit at its peak. Like I think, I obviously haven't been doing quite as much acute work lately, just because I'm very pregnant. So I've been away from that a little bit, but right now we're definitely seeing like the biggest peak in mental health. I know some people that I've been working, that have been working for 10 years, and they said this is the most intense or biggest peak that they've seen for mental health, both in adult and child and adolescent psychiatry that they've ever seen. And I think that COVID has has part at least to do with that. I know part of too that we've unfortunately lost some of our beds in the province just from physicians moving and retiring and that sort of thing. So that's also increased that. But I think we're just doing our best to support and to support schools, and trying to do different check-ins. It's been really tough. I don't have really a specific answer as to what specific supports have been put in for high school students during COVID. I think it's important, if you guys are really feeling that crunch, because it's a lot, to have to do, whether it's online learning or if you are doing, even if you're in class. I think in class is just so different right now for people. There's not as much of that socialization. The classes are really long. I've definitely worried about some of the kids that I see that have ADHD. That's really difficult for them to focus for those really long quint classes. But I think just making sure, that you guys are keeping in touch with whether it's your school counselors, your teachers, your parents, whoever your supports are. If you're struggling, just making sure that you're reaching out.
Awesome. Thank you so much. And I promise the last question I will address to you guys, and then we will let you go. Someone put in the Q&A, when you do research on the internet, there are many stories of physicians who regret medical school. Is that something I should worry about?
I like that. It's an excellent question. I think there are a number, and I see it because I teach a lot of the undergrads. I think many of the undergrads are there, the guys who are in medical school, most of them are there because they want to be there and because they're interested in medicine and they're interested in learning about it. But there are a number of students who are there because somebody else wants them to be there. Because their mom or their grandfather or their whatever thought being a doctor would be a good idea, or everybody in their family is a doctor, so I should be a doctor too. And on the flip side of all of this, medicine is exceptionally difficult work. It's mentally taxing. In my job, it's physically taxing. It is emotionally taxing. I have to say this last year with all of the COVID and stuff and all the change that we're seeing has been probably the most difficult year of my working career. And it definitely takes the toll. And so in order to be here, you got to be here because you love it. I am here because I can see myself doing a few other things, but I can't see myself doing any other things that I would like this much. And so because of that, you carry on with it. But if you're here because, your great uncle from, wherever thinks that this would be a good thing for you to do, then you will quickly get into it and realize that your heart and your soul isn't into it. and this is a mistake. And sometimes you get far enough into it that then it's hard to get out. You know, you've put in the time and the effort and the money, and it's like, okay, well, I guess I better finish being a doctor. And then you end up with doctors who are really unhappy being doctors and don't do a good job. So although I think medicine without question was the right path for me, I think it's not the right path for everybody. And I think, you know, it's important to get out there and try different things and see what you like and see what you do well at, and follow that. And that might take you somewhere else completely, and that's okay. I think the worst thing to do is to push forward into a career where it isn't your love and it isn't your passion, and that kills you little bit by little bit every day. So, you know, that's I think a lot of what you're reading in those kinds of things. But I think it's an important thing to be aware of. So.
Awesome.
Yeah, I guess I'll just pick up on that, Melissa. I can't agree with you more. I sat on the admissions committee for a large number of years, and you know, you could almost tell some of the candidates who had focused since they were 4 or 5 years old that this is what they wanted to do. And I'm just going to suggest to each one of you, really look at your heart, see where you want to take you. Where does your passion take you? What is it that you want to do that's going to make you happy at the end of the day? I'm really fortunate. I fell into a position I get paid very well to do. I love going to work every day. I'm not an administrator anymore, so I can now tell you it's even better because I don't have to go to meetings at 7 in the morning. I'm not at the hospital till 8 or 9 o'clock at night. I'm not putting out fires all the time. I'm actually going to work and doing something that I really love to do. I'm passionate about. And even at the age of almost 60, I'm still having fun at work. And the moment I stop having fun and the moment I stop learning, I'm going to stop. But right now I am having fun. But it's that having fun part that's so important in your work. And if you're there because, as Melissa said, someone else thinks it's the right idea for you, and you really have done nothing but focus on your academics all the way through, you're missing out on something called life. It is a journey. It's not a race. You know what? And if you're doing things like volunteering, now we've invoked this, you need to do 4-year degree. Before it was a 2-year degree. Now it's 4 years. There's 4 years of university life that you get to experience now. Not just sit back and say, I'm going to go to the library from 5 in the morning to 11 o'clock at night. The most important thing to me is to get a 99 on the exam. You're missing out on so much of life. And you know what? You're not going to get it back. Because my age, my mom always said to me, when you're sitting in the rocking chair and you're done, look back at your life and hopefully you will not have any regrets. Whether that's traveling around, staying in the city of Saskatoon, it doesn't really matter as long as you're enjoying what you're doing. So my plea to you is go out and enjoy your life. Don't discount your academics, but make sure there's a balance there. Academics are important, but also look at other things because you may find yourself going in a completely different direction at some point in your life.
Those are great messages for the students. I hope they take them to heart as they move forward in the next couple of years and decide what life for them looks like after high school. So thank you to Dr. Garrett, to Dr. Campbell, and Dr. Moroche for joining us today. We are very fortunate to hear your stories. So we are going to continue on with our panel now. We have 2 more speakers here with us today. Next up, we have Dr. Nicole Levine. She is a Métis second-year surgery resident at the University of Saskatchewan. She completed her biochemistry honors degree at the University of British Columbia, followed by her medical school doctorate at the University of Alberta. She grew up in the Northwest Territories and plans to return there as a general surgeon once her residency is complete. So please welcome Dr. Nicole Levine.
Good morning, everyone. I hope you can see my video. So I'm a second-year general surgery resident in Saskatoon. I guess I will tell you a bit about my day because you've heard from a lot of full staff physicians, but kind of where I am in my career is I've finished medical school after finishing a full undergraduate degree. Finished medical school, did CARMS, which if anyone has any more questions about that, I'm happy to talk about that too. Did CARMS, you kind of get matched to a spot. And I've matched to surgery in Saskatchewan. So now I'm here doing a 5-year residency program specializing in general surgery training. I didn't always want to be a general surgeon. I kind of fell in love with it accidentally. In medical school, I got a chance to experience the operating room and absolutely fell in love with being in the OR. General surgery is, I think, unique amongst surgical specialties because we cover everything from thyroids to trauma cases to colon and bowel cases to your average everyday appendix that needs to come out and your gallbladder that needs to get removed. So in your residency training, our hours are a little bit different than staff hours, like the physicians you heard from just previously. I start work every day at about 6:30 in the morning, and I work till about 6:30 at night. And then every 4th day, we do 24 hours. Well, it's really more like 28 hours of call, which means that we're in hospital. We are the only kind of doctors that are left in hospital overnight, and we cover kind of all of the acute emergencies that happen in hospital overnight. So last night I was on call. I started the morning of at 6:30 and then worked until this morning at about 9:30-ish and came home. And so I'll have today off and then go back to work tomorrow morning. And we do that kind of every 4th day. You'll work one of those extra long shifts, sleep in the hospital overnight. Last night we had a surgery that went from, when did we start? I think we started at 9 p.m. and finished at 3 in the morning. So we operate all night long, 24/7. That's like where your team that covers all hours of the day, we're always operating and busy and doing things. And so surgery is kind of one end of medicine. It's a very like high adrenaline, high acuity specialty, which I think is what I love about it. But from my perspective, I think I'm kind of close, not as close as the medical student who's going to talk next, but I'm close to you guys in terms of where you're at in your lives and your high school careers. I remember being in your shoes because it was not all that long ago. I think my biggest advice for you guys, this is kind of just some really direct focus things, but one is apply for scholarships. There are so many scholarships that exist across Canada that sometimes go empty and unfilled. And it's really quite unfortunate because I think for my undergraduate degree, my first undergraduate degree, I had somewhere between $70,000 and $90,000 worth of scholarships. So you should apply for as many scholarships as you can out of high school. I think that's so important, and it looks great on your resume, and that's something that to this day, some of the larger scholarships I've kept on my resume. So it's just, you should apply for as many as you can, because those interviews and those processes and those applications are great experience for whatever you want to do later on in life. And secondly, I think it's really important to not try to fit yourself into a box. I think unfortunately lots of high school students think that there's a kind of a way to get into medicine, and that's not at all true. I've done a lot of work sitting on admission committees and seeing other applicants, as well as having applied myself. And I think the best thing to do is find something you're passionate about and to do your very best at that. People will recognize you for your skills, and the relationships that you'll make in your passion fields will be things that will get you to where you want to go in the future. For me, as a student, I was very passionate about environmental sciences. I actually traveled to Antarctica and to the Arctic doing environmental circumpolar research. And that, I think, was something that, like I brought up in a lot of interviews, and it was a big highlight of kind of my life experiences. And so those types of things, they sound very out of the box and they don't really sound like they fit with medicine, but you learn a lot about yourself, and they are what you should be looking towards doing. If you want medicine is what you're passionate about. It's not about volunteering in a hospital for X number of hours. So doing what you're passionate and looking towards those things. Those are my biggest pieces of advice for you guys. But if you have any more questions about medical school, CARMS, residency, feel free to put them in the chat and we can chat more about them.
Well, thank you so much, Nicole. There is a question in the chat, and I think that what you mentioned addresses it a bit. It says, in your opinion, is the interview process as equally important as the Mcat towards medical admissions in Saskatchewan? And so you may not know the exact balance, but if you would like to maybe address that question about the interview process, because you did mention how you've shared those life stories and life experiences of yours in your interview process. So how would you say the interview balances out with the actual MCAT?
Yeah, I would say like your marks, your grades, the MCAT are all things you have as part of your application before your interview. So that creates a pre-interview score, and that score is kind of set in stone and basically gets you to the interview. What's going to set you apart is the interview process. And so that's where you're going to find that your rank will change, is based on how that interview goes for you. So I think having those life experiences to draw on are very important for the interview process, and that will come through there.
Awesome. Thank you. There's one more question for you here. It says, is it correct that quorums is only offered to Indigenous and people of Black descent?
Sorry, CARMS or?
Quorums. Not sure what.
Oh, okay. You mean like the like mandatory seat numbers? Yeah. So most medical schools in Canada have a number of seats that are set aside for Indigenous students. The purpose for those seats is to allow Indigenous students to tell their stories and to essentially provide a different avenue for entry into medical education. Those seats are set aside at most schools like UBC, U of A, and U of S. Not all schools have that. I don't know of any specific like seats of color, but there is, like we spoke about at the U of S, those diversity seats, which are for varying socioeconomic status. So yes, you do have to be of Indigenous descent to apply into those positions. I am Métis, and so I did apply into those seats. At the University of Alberta, we never know if we got in through one of those seats or a different way. So I can't say whether or not I entered the program in those seats, but that was part of the application process that I did, which is essentially a separate interview, an additional interview, and an additional essay.
Awesome, thank you. All right, so we are going to go on to our next speaker, and then if there are any questions for Dr. Levine, then let us know. She is going to rejoin us for some more Q&A. So next up, we have Cheyenne Shirazi, and he is a second-year medical student at the University of Saskatchewan. Prior to entering medicine, he finished 3 years of pharmacy school, also at the U of S. He is the incumbent president of the Student Medical Society of Saskatchewan and is passionate about student-led advocacy. He loves to travel and spend time with his friends and family. So please welcome Cheyenne.
Hi, thanks Michelle for having me, and thanks to all the speakers who went before me. So I'm going to speak a little bit about my experience with medicine, why I kind of entered medicine, and what medical school is like to some degree. And I'll try to keep it quick so that we can get to some questions. So I graduated high school in 2015, so probably the closest out of, well, definitely the closest out of any of the panelists that spoke. I remember when I graduated high school, I knew a direction I wanted to head in was healthcare, and I didn't want to spend too long in school. So definitely ended up failing on that second one. So kind of looking at those options based on my, wanting to get into the workforce a little bit quicker, I ended up going to pharmacy school. Pharmacy was a great profession, but it didn't quite appeal to me. I liked, more hands-on. I liked being in the hospital a bit more, and I liked the idea of a more holistic approach to healthcare as opposed to pharmacy, which is a lot more focused on medication and drugs. So I applied to medicine and I got in my third year of pharmacy school. And then, so since I've gotten in, I think the best thing about medicine, in my experience, is that when you get in, it's almost like starting high school over again, in the sense that you have all these different career options available to you, and they're all very different. So something like a general surgeon or a surgical subspecialty like brain surgery, you can do that, and that's very physical and hands-on. And then you could also do the complete opposite of the spectrum. You could go to psychiatry and be more focused on a completely different aspect, and you never have that overlap, but it's all within the same profession. And there's just so many options, and I think anybody in the field of medicine can find something they love as long as they're interested in healthcare and taking care of people. And there's even government approaches, like there's, you can do a residency in public health, so you can work with the government. And for example, they've been dealing a lot with the pandemic. That would be something that their job would be there. In terms of medical school, certainly getting in is notoriously challenging, but it's not as bad as everyone says, in my opinion. It's like a lot of high stakes, and certainly people, it's like, for a lot of people, this is everything you've dreamed of. There's a lot on the line. But the process in terms of the application process is actually pretty friendly, and the interview is surprisingly fun. So, I mean, there's definitely things to look forward to. When you're in medical school, again, everyone always says it's very hard, and certainly there's a lot of content. If you don't like studying, you can still be in medical school. There's a lot of stuff in medical school that you don't need to necessarily study. It's, you hear it and you get an approach to something, and you can take that into tests and stuff. But there's definitely lots of studying involved. I've never been in any program that's has had more studying than medicine. It's definitely the most, but it's not life overtaking, put it that way. You can easily have a balance. And I would say that first year of medical school, just because COVID happened, but that first year of medical school, sure, there was again a lot of studying, but there was also a lot of fun times, hanging out with friends, a lot of events, and you have time for all of that. You have time to play games. You have time to watch movies. I watch games. I watch movies. I exercise all the time still. You have time for a life. A lot of people have that misconception that medical school does take over everything. It doesn't need to, and you can definitely come into that with the balance. So if that's something that scares you, one thing that scared me when I was going into medicine was I would look up and read everywhere. Everyone says you give up your 20s. I don't think you need to give up your 20s. I think you can still have an amazing life while being in medical school and pursuing your passion that way. And then finally, just for why I went into medicine, I think it's a really stable job. You're always going to be in demand. It pays well, but then most importantly, and this should always be the major factor, is that I'm really interested in the knowledge that a physician has and how they apply it, and how it can really kind of change someone's life completely if applied correctly. And that's kind of what motivated me to go into medicine, and it's kept me motivated throughout the schooling as well. So I'll end my little segment there, and I'll open it up for any questions.
Awesome. Thank you so much for joining us. And we'll invite Nicole and Cheyenne back. And if anyone has any questions, I don't see anything in the chat or in the Q&A right now, but I know that will not last because people have been very active in asking some great questions. I'm just looking through to make sure that we've answered everything. So I know there was a question about scholarships, and I had answered it a little bit, but someone had asked about where you can find scholarships. And so a lot of times students don't realize that their counselors have long lists of scholarships that they can apply for. And like Nicole said, many scholarships go unclaimed. And so that's frustrating because there's money set aside for students. So even sometimes students think, oh, I'm not going to apply for that scholarship, I wouldn't qualify. And sometimes you're pleasantly surprised. So the time it takes to fill out an application for a scholarship is well worth it if you do have the opportunity to get money to go towards your schooling. We have a question. Is it true that when you get accepted into medicine, you get an option to study at the U of S or the U of R? So Cheyenne, would you know about that?
Yeah, so when you initially finish the interview, like before you even get accepted, you put your preference if you'd like to be in Saskatoon or Regina. And then just based on demand, you're assigned to that site based on your admission score. So you know, if there's like 70 or 80 people wanting Saskatoon or 70 or 80 people wanting Regina, it would be the first 60 and the first 40 that way. Once you're in the schooling, you can also change. I mean, that it's a little bit more complicated, but you should choose the site you would prefer initially. However, once you're in the school, in that first year, if you're like, well, I'm in Saskatoon, but I'd really like to go to Regina, or if I'm in Regina, but I'd really like to go to Saskatoon, there's processes to get you to the other site. However, it's very difficult. So, I mean, I would kind of look into which you prefer. There's advantages to both. Saskatoon, it's a bigger center, and you know, there's more facilities here, and a lot more program heads, but Regina has a lot more one-on-one time. And then there's other sites, including PA, and others that like have their advantages of their own in your third and fourth year. So there's a lot of decision making it's really going to depend on what you honestly want to do as well, because some fields you really benefit from that one-on-one time, other fields you benefit from being in the bigger center too. So it's definitely a tough decision to make, and even I don't know if I made the right one. So
all right, another question. Do you find that med school residency is too difficult since you are studying every field and not just the one you want to go into in the future? I want to go into psychiatry, and I think I'll have a hard time with the surgical part of schooling.
Nicole, I don't mean to overtake your answer, because I mean, you love the surgical part. I'm actually also interested in psychiatry. And so for sure, it's challenging. You're learning like entire fields worth of knowledge. I mean, at the medical school level, right? It's not like you're not going to be learning at the resident level. But yeah, it's a challenge for sure. Some units, it's hard to learn, particularly for me. Like we just did our ortho unit, and that was really hard because that's a lot of surgeries, and you're looking at X-rays for the questions and stuff, and you're learning how to read X-rays, and it's very challenging, I guess, to start out with, for me at least. But you know, they give you a good foundation, and the reality is that like I would say go into it with an open mind. You know, I came in wanting to do psychiatry, but based on the modules I've already gone through, I've actually drifted more towards internal medicine, which is like all the modules, you know, different cardiology, different things like that. And then also emergency medicine. I think you come into medical school with an idea of like what you want to do, but that can change so quickly. And as Nicole said as well, you know, she didn't want to do surgery right off the bat, but it kind of attracted her. You never know what's going to pull you in. And so that's, I think, keep that in mind, and that you will discover a lot of things about yourself in medical school, and you might discover a new passion that you never knew.
Awesome. Nicole, did you have anything to add?
I guess like it's important to, you know, remember that even if you're going to do psych, and some of my best friends are psychologists, and some of my best friends are dermatologists and do nothing but look at skin all day, and I'm like, I don't understand. I cut it and then I don't know. But you know, it's important to kind of you learn about the whole body, because some of the best you know, information you'll get is sometimes those patients, I think like the child psychiatrist mentioned earlier, is learning, you know, about those interactions between sometimes physical diseases and diseases associated with mental health. And that's very important, because you have to look at your whole patient and all the systems that can be going wrong. And sometimes we can explain concerns regarding mental health with other bodily systems, and sometimes they interact and associate. So it's important to just know a little bit about everything. And, you know, I get a lot of questions from family friends about, you know, what do I do? Can I have coffee during my pregnancy? I'm like, I haven't delivered a baby since my third year medical school rotation, but you still kind of get asked those questions. So those are just things that as a doctor, you know, you're going to get asked and put on the spot, and things you want to know.
Awesome. Well, thank you so much to both of you for joining us today. And thank you to all of our panelists who were here and shared their experiences. So we won't keep you too much longer. I just want to go through a bit of a thank you list because it does take a lot of work to put these virtual events on. So I would like to thank our partners. The Saskatchewan Health Authority are instrumental in making today happen, and especially Jenna Stashniak and Alicia Robb from the SHA. Cheryl Beukert from the University of Saskatchewan for sharing her important programming information. And I see there was a lot of questions in the chat and in the Q&A pertinent to what Cheryl spoke about. So she did list her email address in the chat, so be sure you check that out. I want to thank the panelists one more time for giving their time to be here today and share their stories with us. And to our partner school divisions, Greater Saskatoon Catholic Schools, Saskatoon Public Schools, Prairie Spirit School Division, and the Saskatoon Tribal Council. Thank you to my colleagues who helped make this event happen today. And finally, thank you to everyone tuning in and taking part in our career exploration event. So with all of our career exploration events, it's very important that we hear from you. So please, I highly encourage you to take the time and give us some feedback. Let us know what you enjoyed about today's event and how we can help make these events better for you in the future. And there's always a bonus. Anyone who provides us with feedback has the opportunity to be entered in a draw to win some awesome gift cards. So students, take some time, give us your feedback, let us know what you thought, and any teachers who are viewing or attending this event, please let us know how you use these resources in your classroom and what we can do to better meet your needs. I also want to encourage you to continue to take the opportunity to map out your career journey while still in high school and connect with the SIEC further. So many of you are interested in the physicians panel. Tomorrow evening, we will be hosting a similar event looking at careers in nursing, where we will also hear from post-secondary programs who offer nursing in our program. So if you haven't registered for that event yet, you can register through our website. And lastly, check out our website. Follow us on Instagram, Facebook, and Twitter because we are putting on events like this all year long. Every month, we focus on one industry, and so we have focused on science and technology in October. We've looked at manufacturing and mining. This month was healthcare, and next month will be mental health and wellness, which will address other health-related careers. So make sure that you are staying up to date, checking out our website, and once again, following us on our socials. Thank you very much for joining us, and we hope to see you at some future events. Thanks.